what advice will you give to other PTA students interested in oncology rehab?
I would just say go for it. There's really no reason that anyone who wants to do this can't do it. It is PT, but you just learn a few extra things. And I think I would encourage anyone who's even considering it, like just do it. There's all the opportunity in the world to do, traditional PT, what you would think of maybe like in the hospital or just outpatient orthopedics, which are all great, really great professions to get into. But if you are a student, this is the time where you're going to have the most people invested in you, the most amount of time invested in you for you to be able to learn. So, and it's a lot harder to go into something kind of more specialized without already having some exposure to it as a student. And it's definitely not impossible. And I'm sure there's, CEUs and there is the residency as well you can do with it. But while you have the chance, I would go for it.
The information provided on this podcast for educational purposes only and is no intent nor should be used as a substitute for medical advice. Consult a licensed qualified medical physician for any issues concerning your health. If you would like to know different strategies to improve your quality of life during your cancer journey, this is the podcast for you. Welcome to Taking Charge of My Cancer podcast, where I'll be interviewing different healthcare professionals, cancer survivors, and I'll be teaching you different resources, tips, and solutions so you can get the best outcomes while dealing with a cancer. So, welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a really exciting guest with me today. This is Walter, and he is a recent graduate from the University of South Florida Doctorate of Physical Therapy program. His interests include health promotion, wellness, and oncology. He plans to pursue a career in oncology and eventually earn his Ph.D. He enjoys on his downtime to play piano, read, and being in nature. And he's been a pain of my existence for the last almost 15 weeks. So I'm kidding. He has not been. And then, sorry, I did not say his last name. So this is Walter Bialosky.
Yes.
So, Walt, thank you so much for being here in this podcast with me.
Thank you for having me.
Absolutely. So, what drew you to pursue a career in physical therapy, and how did you become interested in oncology rehab?
I spent a lot of my life avoiding PT because it kind of runs in my family. My dad's a PT, my brother's a PT, my cousin was a PT or is a PT. And so I knew I wanted to do something health related, but wasn't sure what. So I took a gap year, and then COVID happened and that turned into 2 gap years. But basically just was thinking between clinical psychology, occupational therapy. And then one day finally was like, all right, I'll just give PT a try. And went for it and shadowed one day and was like, where has this been my whole life? So I've been in it ever since then. I'm graduating in May, and with oncology, I actually originally was going to do orthopedics, and so I applied for like an accelerated residency program, didn't get it, and at that point I was like, well, I feel like I'm pretty comfortable doing entry-level orthopedics, so I might as well try something else, something a little more unique, and so I went for cancer. And it was one of the best decisions I made.
That's awesome. That's awesome to enjoy. So before starting your oncology internship, you kind of already told us that was pretty much kind of like, I don't really know much about it. This looks like it's new and different, but you didn't know much about it. What were your expectations and how that really compared for what you actually has been living through?
Yeah, I remember I emailed you like pretty early on because I wanted to, because again, like had no clue about anything cancer related, as most people do. I think a lot of people don't even realize PT is involved in cancer treatment, especially like the patients will ask them every time on their first visit, do you know why you're here? And like 90% of them are like, I have no clue. So I just wanted to get as much information as I could.
What was your expectations, and then how that compares to where you actually experienced?
Right. Yeah. So reached out to you super early, and then you sent me all these resources. And one of them was a podcast with another male student talking about his experience in this setting. And he was talking about how you have to be mature and it's like kind of sensitive areas. And I was like, yeah, that makes total sense. You're probably doing a lot of like Pec minor and all that stuff. And then day one, it was just fully exposed, like breast, everything. And I was not expecting that at all. So that was kind of shocking. And it took probably like 2 weeks for me to feel comfortable, but ever since then it's been fine. And yeah, I just didn't have too many expectations going into it. But I think a lot of the PT principles apply. You have to learn a few extra things, but at the end of the day, the PT is the PT.
Okay. So can you walk us through a typical day during your oncology internship? Like, like if you have in the audiences students that are planning to come into PT, are not just the students, like patients, right? Relatives from patients, or even healthcare providers out there that doesn't know what we do much about physical therapy. How would you kind of telling them a little bit about it?
Yeah, so a lot of what we do kind of depends on the stage that the person is in for their cancer treatment. So breast cancer is what we see probably like 90% of, and then we see the second most is head and neck cancers, and then we see a few like brain tumors, sarcomas, stuff like that. But so I'll just kind of go on breast because you can apply it to a lot of these cancers. So if they're pre-op, if they're going to have surgery done, we'll see them for that, take all their baseline measures, and then we will go ahead and see them post-op as well. A lot of impairments that are present with just any sort of surgery, just swelling, limited range of motion, pain, stuff like that. And then where the more specific to cancer comes in is with the radiation, the chemotherapy, and there's a lot we can do to help with both of those. With the radiation, early on, it's a lot of just education and getting them prepared. So making sure they have as much range of motion as they can in order to, because there's a good risk of losing range of motion as they go through treatments. So there's that with the radiation, and then we kind of taper off how much we see them depending on how hard the radiation is hitting them. And then with the chemo, it's a similar thing, with fatigue being a really important part of that we can address. And then we take them in for what we call a chemo protocol, where we just basically do an exercise. We do high intensity interval training for aerobic activity as well as for resistance training. And that kind of helps them tolerate the treatment a little bit better.
Excellent. Very good. My next question is very close to this, so part of it you already kind of answer it. And what type of patients and diagnosis have you seen? So you kind of already mentioned breast in general, but what other diagnoses do we treat?
So yeah, lots of breast, and then head and neck, any sort of surgery associated with that, and then as well as cancer or radiation chemo. And then we have gliomas, different brain tumors, and then different sarcomas as well. And they all change a little bit for specifics. Like, for example, with the brain cancers, a lot of times we'll do a lot of dual tasking balance versus with a sarcoma, we might do more of just like a gentle strengthening, stretching on that specific area wherever the sarcoma is.
Okay. And as well, you mentioned something with breast cancer patients is important. Some of them who are receiving chemotherapy, a lot of their drugs that they use during chemotherapy is toxic drugs for the peripheral nerve system, which means neuropathy-induced chemotherapy. So it's important, right, for us to kind of really address a lot of balance. We were just talking about a patient this morning who actually had neuropathy, never was seen in PT, and then fell and broke her shoulder in the hospital when she was checking in for her to having her breast surgery. So that has to kind of get the lead and other issues happening after that. But that is kind of very important for the audience out there to realize that we can really mitigate a lot of these side effects from chemotherapy or radiation if we really start early on to try to hopefully prevent some of these situations. How did your clinical reasoning evolve when working with a medical complex oncology patients?
I think I just really had to get down the basics very well because there's so much like evolving stuff going on. Their medical status is sometimes unstable, and then you have to kind of like compartmentalize treatment based on where they're at, what stage they're at in their treatment. So there's different things to focus on with surgery, different things to focus on with chemo, radiation. So applying all the basic PT principles while also keeping in mind all the different complications that can come with the treatments, and also even including like the medications, like the hormone therapy. There was a patient the other day where they were doing pretty well with shoulder range of motion. They're post-surgical, and they started complaining of pain in their shoulder joint. And that's kind of abnormal for a lot of the impairments we see are around like the breast area, the thoracic area. They feel like a pulling under the armpit, stuff like that. And so I was like, why, for what reason would your your shoulder joint, the capsule hurt. And then really kind of figured out that it's probably coming from the medication, the letrozole, which a very common side effect is joint pain. That's just one example where there's so many different things to think about, and it's really keeps you on your toes, and that's why I love it so much.
Yeah, yeah, and you're absolutely right. The complexity of these patients, really, if you have no side effects, it's pretty straightforward. But unfortunately, many of them have side effects that's what make it challenge. They can come now and we can see them 3 months later, and it's not going to be necessarily the same thing. Can be the same thing and can be pretty straightforward, and they're doing excellent. And we run a bioimpedance and just make sure they're not developing any kind of lymphedema. But we don't know how they're going to present based on other situations that happen, right? And not necessarily just based on any type of oncology treatment or cancer diagnosis, but any other things like, we have a patient who broke her shoulder and she was totally okay 3 months ago when I saw her, right? So totally unrelated, but how much propense for those fractures can happen because some of these hormone blockers, right? So it's a lot of things that we can really educate patients on. And I think it's important as well for a lot of the healthcare providers to educate patients in some of these side effects and make them be the ones taking the right decisions about if they want to take that or not. And I know it's important because a lot of them take it because the physician is recommending it to try to avoid recurrence, but you really have to put on the table, is that the right thing to do based on the side effects I'm having for quality of life?
Yeah, and I think part of the decision making that makes it so like interesting and stimulating and engaging is that there's so much to think about. It's like you hear it all the time in PT school where it's like someone can have the same diagnosis and two completely different presentations. And that like completely holds true with this population, even with the treatments they're receiving. So sometimes people are totally fine with the hormone blockers or radiation is no problem, but then chemo kicks their butt or vice versa. And so you can't even really have this like you have a general framework that's just so broad about like this is what could happen, but then you just really have to look at the patient and see what is happening to them. That's kind of where I think the complexity comes in.
Okay. How do you approach exercise prescription for patients undergoing active treatment like chemotherapy or radiation?
I think a lot of the cancer treatments too that we prescribe are just very general health promotion, wellness, full body exercise. And that's again what I really love about this population is we're not hyper focused on like the arthrokinematics of a certain joint and it's not moving this way and that's why you're having pain. It's more like you are going through this crazy inflammation in your body, this toxic treatment, which is life-saving and necessary, but it's doing so many horrible things to your body. And so we just need you to move. We need to get oxygen into your blood, into your muscles, get the anti-inflammatory benefits of exercise and moving and eating healthy. And this is kind of going on a tangent, but again, like all the components of health and wellness, including nutrition, sleep, like we really have to touch on all of those things to give our patients kind of the best outcomes. Because if you just focus on one, it's not, especially with all this stuff that their body's getting bombarded with, they're not going to do as well if you're only doing knee extensions, for example.
Correct, correct. And that's very true, not only on the oncology population. I think we're moving towards more, or I want to think that we are moving towards looking at a patient as a whole and not just the knee or the shoulder or the neck or the back, but really looking at how are you taking care of your whole body. And that goes from what do you put inside your body, how do you move your body, how you actually make your body to rest with the sleep. And we talk about hormones all the time, right? Because we have a lot of patients with breast cancer and they've been either go through menopause or they've been forced into menopause, and all these make a huge role into how healthy and how well of a longevity we can have as well. It's really important to not just looking at the patient the way that we look it up for an oncology patient, but I think that your eyes are going to be looking at a patient in a completely different way, even if you end up doing some ortho. I know you would like to go into oncology, but if you end up doing any ortho, you're going to start looking patients with a different pair of eyes than what we used to in the past. I can guarantee you that.
Yeah, definitely.
Yeah.
I think the health promotion and wellness is up and coming, trying to get a special interest group with the APTA. And I think it's just like a huge part that we have been missing all along. And it's a area where we can just add so much value to a patient's life because it's just so like that, I think, is how you treat someone holistically, is you look at everything, not just your shoulder's hurting. You need to know like, why is your shoulder hurting? What are you doing that's making this process harder? Either, not obviously you're not doing it to yourself on purpose, but you just don't even know.
Yep, correct. That is correct. Oncology rehab can be emotionally intense. How do you navigate difficult conversations or moments with patients?
Yeah, I think the most important thing is just for me, I'm sure everyone kind of goes about it a different way. For me, I just try to be as like down to earth, as present as possible, like as engaged with them and not, soar too high and try and be too optimistic. Like if it's a stage 4 cancer, I'm not gonna tell them, oh, don't worry, you'll be fine. But also we don't want to focus on being super pessimistic. I don't know, everyone's needs are different, and at a certain time someone might need you to be really optimistic. At another time they might just need you to sit in silence with them. And so I think just not flying too high, not flying too low, being engaged with them is kind of the best way that I've been able to help people, and also just focusing on the important stuff. So like, what's your quality of life looking like? Especially, I've only worked with, I think, 2 or 3 people who have stage 4 cancer. And this is not just applied to stage 4, but where they have a pretty poor prognosis. And it's just like, we need to just focus on, well, this is the time you have left. Let's enjoy it. Let's do the things that are important to you. And I think giving them value, finding meaning that way is a whole lot, is just how you can be helpful to them.
Very good. How are you coping with your self-care when you go through such an emotional? I know has been times that you cry, sometimes that you have been holding back from crying, sometimes that you have seen me crying. So how do you go home and kind of do some self-care to kind of like, okay, we need to try to really get balance, right? Because we take a lot. It's a lot of emotional things happen every day with every patient. They go through a lot. And we've been thankful every time how we just really shouldn't be complaining with the smallest stuff. Like a little neck pain that I have on a daily basis should be a piece of cake, right? That shouldn't be a major thing versus when all these patients go through. So you definitely see life from a different perspective. But what do you do for that?
Yeah, I think truthfully, before I started early on, I thought that I was going to be able to just kind of go through this, not really get too affected emotionally because, I have experience with death, and I guess my life view is just, people are dying all the time. And so it's just a natural part of life. But it's really hard to like be that removed and that kind of robotic about it when it's someone that you really like form a relationship with, especially with me, where I've been here for, I think this is like my 13th week. You definitely start to form bonds, and it's hard to it's hard to not have that human side. I think has helped me a lot, honestly. It's just given me a good perspective. And then just, I think, compartmentalizing at a certain point too, kind of leaving work at work. And I think also it's like the benefits and the joy and the goodness that I feel from knowing that I'm helping these people and like actually making a big impact on these people, like far outweighs any of the sadness. So it's, even though it's like emotional in my mind, and I think in a lot of people who work in this field, it's not like a, sad, horrible thing. It's almost like uplift. It's a beautiful thing, I guess.
That is true. And I think it's a beautiful thing because patients are just so like, they're so grateful. There is just really sometimes they go through all these horrible treatments and we are the light. They're like coming here looking forward to us making them feel better. And it's great to see progress and see people who motivate themselves so much to really improve and try to get their life back. How has this experience changed the way that you view a patient care or life in general?
The next thing I was going to say is it really has changed my view on just symptom management in the short term, because through PT school and then, having relatives who are PTs, I was always kind of biased against all these kind of short term interventions where it's like, yeah, it provides relief for a week or two, but then you go and study them 6 months, a year later, follow up, and everyone's kind of averaged out and everyone's regressed to the mean. And so I think when I didn't know as much, in my mind, anything that was not like, this is a long-term benefit, I was like, oh, well, then it's useless. And I completely disagree with that now. I think this population is a great example of just the power that we have to kind of not, I don't know, be somewhat like hold someone's hand through the whole process. I think there's a lot to be said about that where and also a lot of times, especially in any like, orthopedic condition where they're gonna get better most of the time anyways. A lot of the value that PTs have in those cases are providing that comfort and providing the education like you're gonna be okay, like just keep doing your normal things. I think relieving people from that anxiety is like huge. And so all these short-term things that we can do for them, whether it's like putting our hands on them or just saying like you're going to be okay. I think those are very valuable.
Okay. How did collaboration with oncologists, nurses, or occupational therapists shape your approach?
I think kind of staying on like to answer that question, but to also stay on things I'm learning through this is just the importance of having a good connection with like a interdisciplinary team and with the medical side specifically. You're like definitely the most well-connected PT I've ever met. It's ridiculous. There's like people out in Ocala and any sort of medical provider, everyone knows you and you know them. And so I've seen the power that that can have. Like there was a patient a couple weeks ago who wasn't getting their pain medication for radiation. And if it was just me, I would have been like, I have no, like, call them, reach out to them, but I don't know. And you were like, oh yeah, I'll make a call. And then you had them go and see them like that very day. So there's that side of it where like, yeah, it's nice to be connected so you can kind of get patients in, but also just knowing how the medical side affects the PT side and then vice versa can help you really be a much more effective clinician, I think. Knowing like this different interventions that are going to be done for them medically and what you can even kind of recommend and educate based on that because the medical side usually doesn't have the luxury of having as much time to spend with patients. And so we can sit down and really explain things to them. And so knowing that side just makes you kind of more well-rounded and again, treating them holistically rather than just, okay, we're going to measure your range of motion and hope that that gets better. And that's all we're going to do for you.
Yeah. And again, adding to that as well, we are so fortunate to have a great multidisciplinary team where we can just, a phone call away or, epic chat away for things to get rolling in the way that needs to be rolling, which again, I'm so grateful for because of other institutions or so many other PTs that are totally isolated and they don't have that ability to do that. But again, looking now into now, if somebody comes to you and needs either a speech pathologist because they're having a hard time eating, moving their tongue after a hemidiglosectomy or any kind of head and neck cancer, or somebody's really struggling mentally and emotionally with this, then like, oh, we have an occupational therapist, or now is somebody there that they can go and talk to help them to cope with that emotional component on it. Or we just need to refer them to a psychologist or a nutritionist or a medical fitness program. So really looking at what tools can I give you so you can continue being involved in your care from now on is super important.
Definitely.
What are the biggest challenges that you face during this internship?
I think one of the bigger challenges has just been like the time management because these patients have so many needs a lot of the time. Sometimes, maybe 10% of them, it's just easy, quick in and out, and that's fine. But a lot of them, you could literally spend like 2 hours with like every single session, especially for the newer sessions. Like as you get them going, it gets a little bit less complex in terms of how much time you have to spend with them, but especially the new patients because they're just have a new cancer diagnosis and there's so much information that they're getting from so many different people from the medical side to any other rehab team, any OT, SLP. And that's the beauty of it is that there's all these people helping them in all these different ways. But then that's also the challenge of it where it can be so overwhelming. You just have so much information. So I'd say just having the time management to not spend 2 hours with the patient and be like, okay, sorry, we gotta move on to the next one. And it's been nice here because I'm with another student, so probably more than half of the time we get to just spend hour or two with someone, or hour and a half. But I know that's kind of a luxury that in the future I'm not gonna have. So.
Yeah, that is so true. But like I always say, when we have the ability and the help, why not, right? If the patient needed, why not? Again, sometimes I'm questioning if like the patients get used to it, and then when you don't have them for the hour and a half, it's like, wait, are you why are you making my appointment shorter, right? But, make them realize this is not reality, usually happens that way. But what advice will you give to other PTA students interested in oncology rehab?
I would just say go for it. There's really no reason that anyone who wants to do this can't do it. It is PT, but you just learn a few extra things. And I think I would encourage anyone who's even considering it, like just do it. There's all the opportunity in the world to do, traditional PT, what you would think of maybe like in the hospital or just outpatient orthopedics, which are all great, really great professions to get into. But if you are a student, this is the time where you're going to have the most people invested in you, the most amount of time invested in you for you to be able to learn. So, and it's a lot harder to go into something kind of more specialized without already having some exposure to it as a student. And it's definitely not impossible. And I'm sure there's, CEUs and there is the residency as well you can do with it. But while you have the chance, I would go for it.
Okay. What changes would you like to see in how rehab is integrated into cancer treatment?
I would just like to see more of it for more diagnoses. Like it is mostly breast cancer, and it makes sense because there's very clear impairments that basically anyone can do. So there's like the lymphedema, there's the post-surgical complications with shoulder range of motion, and all the kind of traditional things that people typically think of a PT being able to do. But there's so many different things with fatigue, peripheral neuropathy, any sort of secondary effects for any patient, regardless of the cancer, who is receiving any sort of treatment for it. Maybe not necessarily in a super aggressive, pancreatic cancer, something like that. But for example, there was the recent challenge trial was a big research paper came out I think last summer talking about it was the first ever randomized controlled trial where they used exercise as the intervention. And they found that exercise was just as effective as a lot of currently approved chemo drugs. And that was for colorectal cancer specifically. So I haven't seen a single colorectal cancer while we're here. So I think there's no reason that we can't be a really valuable member of the team for cancers other than breast, head and neck, more of the traditional ones.
Perfect. Okay, so I'm going to do some little rapid fire questions to you. One word to describe your oncology internship.
Eye-opening.
Coffee or energy drinks during clinicals?
Not during clinicals, but I've started doing weekend coffee. I really enjoy those.
Most surprising things you learned?
Most surprising thing I learned? Probably, honestly, just how much we can help patients with cancer.
One thing you wish you knew before starting?
That it was going to be well, I don't know. I don't know if I have a good answer for this. I'm just going to say I wish that I knew how amazing it was going to be. I don't know.
Awesome. Well, that's a nice way to wrap it up. So, well, it has been great having you in these last 13 weeks now, 2 more weeks to go. Has been really fun having you, and thank you again for this amazing conversation. My goal in life, I always say I want to convert every student who comes through here in my future oncology specialist colleagues, and I think you will be a great one. So hopefully we'll continue in touch and continue learning along the way. So thank you again for doing this with me.
Thank you. It's been great learning from you.
Awesome. Okay, so see you later. Thank you so much for listening to the latest episode of Taking Charge of My Cancer podcast. If you have not already, feel free to share this with more people so they can benefit from this information. If you would like to connect with me, see the information on the podcast description. See you later.